The Markkula Center for Applied Ethics is excited to have everyone tuning in today to join us for our final Get Vaccinated webinar. During the next half hour, we will be talking to two professors from Santa Clara University's Department of Biology about what people should know and consider about the pandemic as we enter the holidays. To introduce myself, my name is Amana Liddell, and I will be hosting today's webinar. I am a senior at Santa Clara University, majoring in biology and psychology, and for the last couple of months, I have been working with the Ethics Center to help with these Get Vaccinated webinars. For today's webinar, Navigating COVID-19 this holiday season, we are joined by two guests, Craig Stevens, the Sanfilippo Family Professor in the Department of Biology and Public Health, and David Hess, Associate Professor and the Director of Biotechnology Program at Santa Clara University. Professor Stevens is currently the Public Health Program Director, and Professor Hess is the Biology Department Chair. Additionally, both Stevens and Hess have served on an advisory group for the Santa Clara University operations regarding COVID-19. We're excited to have you both joining us today and to talk about what we should know about keeping ourselves and others safe this holiday season. To start us off, could you tell us why experts are concerned about a surge in COVID-19 cases as the holidays approach? I know that specifically in Europe, they're already starting to see this surge in cases, and kind of explain a little bit of why this is happening.
Sure. So I'll start off taking that question. So there's a variety of factors that come to play. So one, we're all aware that we're traveling more. So that means people are mixing more and gathering in the holidays. But also the weather's turning colder, which means we have a lot more things inside, events inside. And so it's that combination of people traveling, gathering in groups, but then also tending to be indoors more. We know that COVID doesn't spread as well outside. It's sort of safer to be in gatherings outside. And so those combination of factors definitely lead to a higher risk of spread.
Okay. And so to go on to like our next question, there's a lot of institutions that have a lot that they can do, whether that's having employees stay home, like many companies have done throughout the pandemic. But what can institutions like universities, employers, and governments do to kind of help prevent this holiday surge?
I'll take that one. So first of all, I should say thanks to the Markkula Center, and thank you, Amanda, for hosting this webinar series. I think it's been extremely useful. So one of the things that institutions can do, and one of the things actually that gives us a lot of hope that maybe we won't have as much of a surge this year, is to get everyone vaccinated, to get as many people as possible vaccinated. And obviously that's been the focus of many of your webinars. So if universities, large employers, governments can require vaccination, in my mind, that's a great thing, or at least educate and strongly incentivize employees and students for schools to get vaccinated. And at this point, if people are already vaccinated, then, and we'll probably talk about this more, it wouldn't be a bad idea to get a booster shot. There's a lot more to be said about that. But some other things that maybe we could do would be, for example, here at the university, ask everyone to get tested before they go home, to get a COVID test before they go home. So they're less likely to take the virus with them. One of the good things about being vaccinated is that most COVID infections are asymptomatic, or at least very mild symptoms, but that sometimes makes it harder to know if you're actually infected. So getting a COVID test be a good idea before you go home. And then, in our case, if people are going to be coming back after Thanksgiving and then going back again at Christmas time, getting tested when they come back to campus, just in case they got infected while they were traveling. And again, if you go home for the holidays at Christmas, you get tested before you go, and then when you come back. So that can help also to prevent spread both during the holidays and then when you return. And then just generally encouraging people to be vigilant. I think there's a lot of things we can talk about today in terms of, when you wear a mask, where you go, what you do. And so I'll kind of hold off on that, but just, encouraging people to stay aware that even though around here, for example, COVID rates are remaining pretty low, there are things we can do in addition to being vaccinated to help keep that as low as possible.
Yeah, and the only thing that I would add to that, sort of thinking about what the university does to help prevent the spread, is our very strongly adhering to the indoor masking requirements, especially in classrooms. So again, with thousands of students, we've been very happy that we've had a very low breakthrough infection rate of just in the 20s of students. But each student takes about 4 classes. So that has been, we've had almost 100 classes where there's been an exposure event. And to this point, we've seen no evidence of classroom transmissions. And we think that's obviously in large part because of vaccination, but also because of the indoor masking. So when you combine those two deterrents, it's really powerful to preventing the spread and containing and preventing any single case from becoming an outbreak.
And I think that's a really important thing that we've touched on throughout these webinars is it's not just one thing that people are doing that helps prevent the spread, but it's really the culmination of different things like social distancing, masking, making sure that we're vaccinated, and different things that help us prevent the spread of COVID-19. And so taking that, how should people approach their holiday plans this year?
So, I mean, I think this year, especially if you're fully vaccinated, it doesn't have to be as scaled back as last year. The CDC is still recommending, not having overly large gatherings. So to think about, keeping it somewhat more limited in scope. For me, even if I was vaccinated, if I knew that there were members of my family that weren't vaccinated, I would get tested to rule out an asymptomatic infection. I wouldn't want to expose, I wouldn't want to expose anyone ever, but I certainly wouldn't want to expose an unvaccinated loved one to COVID. So just getting the tests sort of 2 days before you have a big gathering like Christmas Eve or Christmas or New Year's, that's a way that you can take a little step to protect your family in addition to being vaccinated.
Maybe we should mention now that there are home COVID tests, what we call antigen tests that you can use, and they're not as good as PCR tests, admittedly, but they still have some practical value, I think. They're actually pretty good at telling whether you have enough of the virus to be infectious to other people. Most of the time, they can give you a pretty decent answer towards that. So, getting a negative test on a home COVID test doesn't guarantee that you're not infected. It's not as powerful as a PCR test, but if you're at home and it's hard to get a PCR test and you have a cough or something like that, you have, say, some kind of respiratory symptoms or a fever, having one of those home COVID tests available might help to ease your mind a little bit to say, is it COVID or is it something else? Because there are a lot of other things that now that people are out and about more, the flu is coming back more this year, for example. And, of course, there's always colds and things like that we're seeing, like on a college campus, where people are mixing a lot. We're definitely seeing a lot of that. So having some of those home COVID tests available is probably a good idea. And they're not always easy to get a hold of, but if you happen to be in, a Target or a CVS or something, and you see some on a shelf, they're pretty cheap, and I think they can give you some peace of mind in some circumstances. So not a bad idea to have some of those around.
Awesome. And so kind of in addition to testing, what are some key steps that people can take to ensure a safe holiday season?
Well, I would, think about, I guess the traveling part is one, and then what you do when you're home is another. I think if you're traveling in any, especially if you're on a plane, in an airport, anywhere besides your own car, I would definitely wear a mask. And you might even think about getting a KN95 or an N95 mask to give you a little extra protection versus like a standard cloth mask. I think, as David said, getting tested, if you have access to that, is not a bad idea. I would also think carefully about going out in crowded public places. And if you do, even if it's outside and it's really crowded, I would definitely wear a mask. And if it's inside, like a crowded shopping mall or something, or Black Friday sales, I don't know. I personally would think really hard before doing something like that, because you have no idea what any of this, the vaccination status or anything like that is of all the people around you. So I think, this holiday season might still be good to be pretty, back off of those really crowded situations. And then the last thing is, I would, if you have a chance to get a booster, and we can talk more about boosters and the efficacy, but in California right now, they're available for anyone over 18. And I think that, especially if your first shot was 6 or 8 or 10 months ago, I would go ahead and get a booster. I got one, last week, and we don't know exactly how much more protective they're going to be, but it's certainly not going to hurt you. And I think providing that little extra margin just before we go into the holidays, I think that's actually a pretty, better safe than sorry, in my opinion.
Yeah, and I'll just add on. I also got a booster last week, and my reasoning was it was as much to protect the elderly relatives that I'm getting together with at the holidays than it was for my own personal health. And so that's one of the things you can consider when getting a booster, that it's as much to protect those that are vulnerable around you as it is your own health.
And I think that's a very good point about COVID in general, and all of these different safety measures that we are taking is, yes, they are often protecting us, but they're also protecting those around us. And especially as we get into the holidays and we're spending time with our family and our loved ones, it's very important that we are protecting them as well, especially for someone like myself, who's a student who will be traveling home. There's lots of steps that people who are traveling can take to ensure that they're keeping everyone else safe as well during this time. And so one other question I have for you guys is, what advice do you have for people who are trying to figure out how to navigate deciding whether or not to celebrate the holidays with friends or family who are unvaccinated?
Yeah, so I mean, this is always a somewhat tricky question to navigate, but I think it's good to have sort of as much data as you can. Different parts of the country are in very different vaccination states and very different infection rates. So one of the things that you can do is when you're traveling back home, especially, well, if you're traveling outside of Santa Clara County, you can Google your county name and then COVID data. And there's a pretty much uniform reporting system across the United States. So as long as you're traveling domestically, and that will let you know things like, what is the current infection rate? How many hospitalizations? What's the vaccination rate in your county? So I think just being armed first with that information is important, because you start to get an idea of relative risk. If cases are really high and you're worried about exposing unvaccinated family members, that might be a case where obviously the safest thing to do is to not get together with them. But that's also where you really might pursue getting a test just before getting together. But I think knowing what the situation is where you're traveling to is very helpful.
Yeah.
Great.
Amanda, can I just add one
Yeah.
other thing? I think when we were talking about traveling, there was one other thing I wanted to say, which is wash your hands. When you're in an airport or you're traveling, any place like that, even if COVID wasn't around, this is the way that a lot of colds and stuff get transmitted. So I would just be extra careful about hygiene and stuff, especially if you're in crowded places like that.
It's a very good point, and one that kind of does often kind of get forgotten as one of the simplest and
Yeah.
easiest things that we can do to protect ourselves
Keep your little
from getting
bottle of
sick.
hand sanitizer with you, that a lot of us have had for the last year or two.
Exactly. And so another question is, if people are choosing to spend the holidays with people who are unvaccinated, what advice do you have for people who are trying to encourage those family and friends to get vaccinated?
Yeah, this is a pretty tough one because a lot of us have been dealing with this for, not just at the holidays, but, you know, some people are very hard to convince, but I think there are, a few key points. One is to say that, COVID vaccines have been tested very extensively, because one of the things that people often say is, well, they developed it so fast, how can it be safe? At this point, they were tested and carefully monitored on tens of thousands of people. And since then, literally hundreds of millions of people have been vaccinated. So I think we really have a pretty good idea of the risks of COVID vaccines. And I think that the risks of COVID clearly outweigh the risks of the vaccines. These are really remarkably safe vaccines. It doesn't mean they're perfect. There's no vaccine that's perfect, but they're really remarkably safe. And as someone, I've had 3 shots now of the Moderna vaccine, and the side effects have been pretty mild. I mean, the worst it was I had a mild headache for a day and some muscle aches, and my arm was sore where I got the shot. But really, most people who have had the vaccines, their horror story is usually about feeling bad for a day or so, 2 days at most. So and I know hundreds or thousands of people on campus now that have gotten vaccinated. So I think that the side effects are not something to be terribly afraid from. Another thing is that a lot of unvaccinated people by now have had COVID, right? And so they say, well, I've had COVID, so why do I need to get vaccinated? Well, there's still pretty good scientific evidence that getting vaccinated, even if you've already had COVID, will boost your immunity further. That immunity from having naturally experienced the virus may not actually last as long as immunity from being vaccinated. So you can still protect yourself more. And, with variants arising, I think that, getting vaccinated is still the safest way to go. Now, one of the problems, of course, is that people listen to a lot of social media, and there's a lot of vaccine misinformation out there. And, telling them to go to the CDC website may not convince very many people if they don't trust the government. But telling them to talk to their doctor or something may help convince them. If you can't trust your doctor about health issues, then we're in pretty bad shape. So asking them to talk to somebody else that they trust, like a health professional, could be a good idea. I wouldn't hold out hopes that you're going to convince everybody, but if it comes up, then I think those are some of the things that I would recommend.
Yeah, and the only other thing that I can think of is to understand. So one of the things that I see on social media a lot is this idea that, well, the vaccines are proven not to be effective because there's breakthrough infections. That's just simply a gross misrepresentation of the truth. Yes, there are breakthrough infections. Vaccines are still, you are at least 5 times less likely to be infected. And then it's not just about infection. Even when you account for that, you're still far less likely to be hospitalized and far less likely to die if you are infected. So the vaccines, and then what's less appreciated, but is also well documented, is you are less likely to spread it to someone else if you're vaccinated versus unvaccinated. When we look at contact tracing clusters, where large sort of super spreader events was the sort of one of the words of the day in 2020, those are occurring now by and large amongst unvaccinated people as the sort of nexus of those super spreader events. So there is a lot of benefits to being vaccinated.
Thank you. And so I think that this kind of segues us pretty well into kind of talking a little bit about booster shots as we talk about the different benefits of vaccination. And so what do we know about booster shots and their impact on our immunity against COVID-19?
Booster shots are most effective if you've so I'm just going to deal with the 3 major vaccines in the US, but being aware that there's a global vaccine regimen, but probably most of the people here have had one of the US. So if you had the Johnson & Johnson, I would very, very strongly recommend you getting the booster shot. There's clear evidence that getting boosted with either Pfizer or Moderna boosts your immunity incredibly with a booster shot. If you had Pfizer or Moderna and you're past 6 months, there's also really good evidence that a booster shot is very effective at helping maintain the duration of high immunity to COVID. If you've just recently completed your vaccination, that's more where I would sort of talk with your doctor, see if you have any comorbidities or immune compromised situation that makes you particularly vulnerable, and sort of plan with your doctor when would be the optimal time to get a booster shot. But if you're sort of just 2 to 4 months out from having completed your vaccination, I personally would wait, but I think that's a good conversation to have with your doctor. But more than 6 months, that the evidence is clear is that it helps sort of restore your immunity to a much higher level.
Yeah, the only thing I would add is that, the fact that we're talking about boosters doesn't mean that these vaccines don't work, right? It doesn't mean that they're bad vaccines or that, well, maybe we shouldn't have bothered in the first place. It's just that, no vaccine lasts forever. And we don't know yet, because it hasn't been that long, what the long-term durability of immunity is going to be from these vaccines. But I think while COVID is still circulating, it's in our best interest to make sure that we're as protected as possible. And so at this point, if we can, top it off a little bit, and as David said, especially with the J&J vaccine, for example, that may not have worked quite as well the first time, that we should. But in terms of protecting us from severe disease and death, I mean, these vaccines are still doing a pretty darn good job. The booster is just to try and make sure that we, extract every last bit of protection out of this that we can. So,
and I think it's important for people to realize, and it's kind of easy for sometimes me to forget as a biology professor, where it's sort of second nature, that not everybody understands. There's a huge variety of viruses. So you have things like polio, where you'll get one shot and you'll have immunity for life. And that's because of the nature of what's being vaccinated against with polio and how polio interacts with your immune system. And then you have things, at the other end, like the flu, which is, you'll probably have to have flu shots if you want to have some protection from the flu every year, for a long time, unless we have some breakthrough. And then there's things in the middle, like that you might be familiar with, like a tetanus shot. So a tetanus shot is very, very effective and very important if you've had certain types of injury or like an animal bite. But it only lasts for about 10 years. And in fact, if you're more than 5 years out and you have a certain type of injury, they'll recommend getting another tetanus shot. And so, if you're talking with people and they show kind of some hesitancy, you can sort of remind them there are things in their life. I don't know anybody that would say, well, don't give me that tetanus shot. You have to get it every 10 years, so it can't be any good. Or your animals, right? Your animals get rabies vaccines about every 3 years. So if you have pets, there are certain vaccines, and it's not that the vaccines are bad, it's the nature of the virus and the mutability and how the vaccines have to be built. And so just different viruses have different vaccine regimens. And I think there's a few touch points if you're having conversations with people, like rabies vaccines for their pets or a tetanus vaccine for people, that are these vaccines that only have a certain length of efficacy with them, that you can kind of point to. And this is what the COVID vaccine, the category it sort of falls into.
Just to add on to something that David mentioned is, I would strongly encourage everyone to get a flu shot this year as well, right? I mean, the flu virus is an example of one that changes a lot from year to year. And so, a flu shot's not perfect. It's nowhere near as effective as the COVID vaccines. It might only provide you 50 or 60% protection, but still that's, cutting your risk of illness by more than half. And there's a lot of flu going around this year. Last year, for whatever reason, it was a very mild flu year, maybe because a lot of people were wearing masks, etc. And it seems to be coming back with a vengeance this year, especially on college campuses, for example. So, a flu shot is, if it's convenient for you to get one, or even if it's not very convenient, I would still recommend doing it to give you that little extra protection from the flu as well.
It's a very good point. Yes, I think especially there are different things that will contribute to kind of helping protect us from the flu, like everyone wearing masks and hopefully washing their hands more vigilantly, because there is still a pandemic going on, but also getting our flu shot and getting our COVID-19 booster shot, or our primary vaccination, are all very important things, and steps that we should be taking as well to make sure that we protect ourselves. With the few moments that we have left, do either of you have any closing thoughts to share with our audience about whether it's booster shots or traveling and celebrating the holidays this year?
I would just say that I think if you're vaccinated, especially if you've had a booster and you've done everything you can to get people in your family vaccinated, I think you can probably feel a little more comfortable this holiday season than last season. I really don't think, especially in California, that we're going to have nearly the problems we do last year. But just because COVID is still around, I think people should still be aware of the things we're talking about, and take good care. And I think we'll get through this fine.
Yeah, I mean, I would just reiterate the same points, that this is a big step from sort of last holiday season, but it still is good to have some caution and to protect those, especially most vulnerable around you.
Awesome. Thank you so much to both of you for joining us today and for sharing all of your insights with our audience. If you weren't able to tune in for the entire event today or want to share this webinar with others, the recording will be available soon on the Markkula Center YouTube channel, along with all of our previous webinars. As I mentioned in the beginning, today's webinar was our 12th and final Get Vaccinated webinar, and it has been my pleasure to be a part of this series and to host many of these webinars. I encourage you to visit the Get Vaccinated page on the Ethics Center website for more information about the work that we've been doing as a part of this campaign to get people vaccinated, and to watch any of the previous webinars that we have hosted. Thank you all for tuning in today, and thank you both for joining us, and we look forward to seeing you in the future.
Thank you.
Thank you.